Good evening, ladies and gentlemen. I remain my humble self, Lucky, Dr. Drugs, and today I'll be having the pleasure of presenting this very amazing topic that affects everybody on earth. As far as there's a kidney in your body, this topic concerns you. And this topic is none other than kidney stone disease, also known as nephrolithiasis. We'll talk about the management and treatment and prevention and a few other things as well. I remain my humble self, Lucky, Dr. Drugs, as aforementioned. And our table of content goes thus. Now, we can talk about kidney stone disease without talking about the kidney. And then we have to talk about kidney stone disease itself, as well as kidney stones. And then we have to talk about the types of kidney stones that are available, just briefly. And then we'll talk about signs and symptoms, as well, causes and risk factors, complications, diagnosis. Then there's some popular terminologies we hear once in a while when people go to the hospital. You hear phrases like kidney function tests, words like urinalysis, you hear things like urine MCS. Some people want to know what dialysis is. Just talk briefly on that. They will talk about the challenges, chemical interventions, and their respective side effects, and natural pharmaceuticals in management of kidney stones. So the kidneys are two bean-shaped organs located in the lower back, playing a vital role in maintaining overall health. Now, these functions include waste removal. We all know that the kidneys help us to filter waste and excess fluids from the blood. And of course, electrolyte balance is not left out. Then we have fluid balance as well, which helps to maintain blood volume and pressure. Acid-base balance is not left out because the pH has to be constant. Then hormone regulation. Erythropoietin, for instance, helps us to regulate something very, very vital. We'll talk about that shortly. Renin as well has a very, very strong role it plays in regulating our blood pressure because it constricts blood vessels, so on and so forth. Then we have blood pressure control. We just talked about renin. That's just one part of it. Red blood cell production is very important, and that's where I'm coming to when I refer to erythropoietin, because it produces erythropoietin that stimulates red blood cell production. That's why when one is in an environment where there is less oxygen, the kidneys produce erythropoietin that will help signal the bone marrow to produce more red blood cells. Kidney stone disease itself, we have arrived. Kidney stone disease, also known as nephrolithiasis or renal calculi disease, is a condition where small hard mineral deposits form inside the urinary tract and originates from where? The kidneys. Now, these stones can cause severe pain, something called renal colic. I heard a rumor that this pain is worse than labor pain, and it's so terrible, can cause nausea, vomiting, and all that. We'll talk about that shortly. Now, they are often crystals that form due to high concentration or amount of their materials in the urine, and they usually pass through the urine unnoticed, but there's problem when they are about 5 millimeters thick and above. You see, when you pour something like salt or sugar inside water and turn vigorously, there'll be a point where the solute, the salt or the sugar, begins to come out of that solution. And that is exactly what happens when these materials are over-concentrated in the urine. And we'll see our God-given #1 remedy to this problem very soon. So if you look at the picture, you can see at the bottom right of our screen, you can see these tiny different shapes and sizes of solid materials. These are different types of kidney stones that have been removed from somebody's kidneys where they were having their union or meeting, and they had to be excised or removed either surgically or via other processes. And you can see that kidney stones or renal calculi are solid masses that develop from the concentration of materials or solutes in the urine into supersaturated urine. As aforementioned, it can be as small as a grain of sand or as large as a pea, like beans. Now, there are small hard mineral deposits that form inside the kidneys when there's an imbalance of water, salts, and other substances in the urine. We'll talk about this shortly. Now, These lead to overconcentration or supersaturation of substances in urine, leading to precipitation of these materials out as solid masses called renal calculi or kidney stones. Now, a similar process can be recreated, as I mentioned, when we add too much sugar or salt in water to form a solution. After some time, the solid material begins to come out of the solution. That is exactly what happens inside the kidneys. Unfortunately, they are not meant to be there because water can pass through the ureter easily, but these stones have this terrible pain that they cause when they pass through the ureter. Oh, look at this picture here at the bottom right corner of our screen. You can see on the extreme right or extreme bottom right corner, you see the kidney that has just expelled a stone and it's now traveling down the ureter. So just imagine this stone squeezing through this ureter down into this bladder where it can cause another problem again. Imagine the kind of pain the person is going to be in. And that's what we're talking about here. Now, the process starts from supersaturation, as I've mentioned, where the urine contains high concentrations of materials like calcium, oxalate, uric acid, which we know is also responsible for gouty arthritis, when we have high blood uric acid concentrations leading to what is called the hyperuricemia, and then you can, or cysteine in rare cases. Now, it becomes supersaturated. This means that the urine holds more minerals than it can dissolve, creating an environment conducive for what? Stone formation. Now, nucleation is when a tiny particle or a tiny crystal, it could even be a bacteria that just appeared, and then these particles begin to what? Form solid material around it, because that means that's giving it a central point of anchorage where they can begin to accumulate over time and get larger and larger before they start causing havoc to the person and excruciating pain. The growth phase is what I just talked about, how they keep piling up on each other, and the stone gets larger and larger over time and leads to problems. Then the stone is formed. And this stone will continue to grow until it becomes large enough to cause problems or block the flow of urine. Now, after formation, the kidney stones can move through the urinary tract, causing symptoms like pain, nausea, and vomiting. Now, the stone may actually pass naturally because some small stones may just pass. Sometimes when people just take a leak, they just feel a sharp pain that just passes sharply, like how they rapidly. And it's just in a split second, the pain goes through. That may have been a kidney stone that God just helped you to expel before it gets larger, you know. And then sometimes it gets stuck, and that's where there's a problem. And that's why you have that terrible pain that is the complication that we call renal colic. The pain is so terrible. I've never experienced it before, and I pray not to. But rumor has it that I said it's like it's even worse than labor pain. So you can imagine what people that have these problems go through. So what are the types of kidney stones we have? Just to talk about this a bit, there are 4 main types of kidney stones classified based on their composition. Now we have calcium stones, maybe as a result of calcium oxalate and phosphate. These are the most common types, accounting for about 80% of all cases. Then we have uric acid stones. Remember, we've talked about gouty arthritis. You can go to Dr. Drugs on YouTube to watch gouty arthritis, and you see how high blood level of uric acid causes gouty arthritis in people. Now, a waste product in urine may actually accumulate to such an amount that it may form kidney stones, and it happens about 5 to 10% of cases. Then we have cysteine stones, which are very rare, but as a result of genetic disorder that affects the transport of cysteine in urine. Then we have struvite stones, which are formed from a combination of magnesium, ammonium, and phosphate. It happens when certain bacteria hydrolyze or convert urea to ammonia. We'll talk about those bacteria shortly. Another form of classification is based on their location. If it's found in the kidneys, it's nephrolithiasis. It's found in the ureter, it is ureterolithiasis. And if it is found in the bladder, it's called cystolithiasis. Let's take very, very good note of these struvite stones, because we're going to be talking about how possible is it that bacteria that affect kidneys or that cause urinary tract infections can actually lead to kidney stones. We'll talk about that shortly. But let's not ignore this wonderful image at the bottom right corner of our screen. If you look very closely, this massive stone was extracted from a man somewhere in the Middle East and weighs about 620 grams. And it is known to be the largest stone, kidney stone, excised from someone. That was in 2008. Just imagine the size of this woman. It's so big. And that tells you how terribly or how terrible kidney stones can be. Imagine this person passing this stone through the urethra. I wonder what kind of pain that person would be if not for surgical intervention. So these are just a few of the types of kidney stones that are available. We just talked about calcium kidney stones. Here they are. This is what they look like, 80% of cases. Look at the risk factors here. Imagine having excessive calcium in the system can lead to this. Excess calcium without adequate solvent, that is water, can lead to that. Dehydration and calcium can lead to this. We have foods that are rich in oxalates. I think there's something that is called the African star fruit, or what is locally called agbalumo or dala or something. I think it contains a lot of oxalate. And of course, we have avocados and dates and all that. Then we have struvites that are as a result of urinary tract infections. This is one other problem that people that have regular cases of urinary tract infection may face. Uric acid stones, this is what it looks like for those that are having gouty arthritis. This is what the uric acid in the blood can result to. Them have cystine as well. So what are the signs and symptoms? Looking at the bottom right of our screen, you see what this man is going through. It's as if there's lava or volcanic material in his back. That is how terrible this pain can be. So kidney stone symptoms can vary depending on the location, size, and type of stone, as well as the individual's overall health. Now, these symptoms may include severe pain, as aforementioned, called renal colic, which is generally described as a loin to groin pain, terrible pain, and then nausea and vomiting, of course. Then frequent or painful urination. Imagine a stone trapped somewhere around where urine is passing through. Blood in urine is not left out because this stone can tear or scratch the inner lining of the urinary tract system. And then you see cloudy or strong smelling urine. That's a sign that the urine is over concentrated. Some people will not drink water until their urine is already looking like something like Coke or something like that, which is terrible. You shouldn't allow that to happen. Fever and chills are not left out because of the infection that may take place as a result of the injury caused by these stones. And not even talk about the infection causing the stones that later cause injury that cause more infections. Wow, what a terrible vicious cycle. Then we talk about abdominal swelling. This may occur if the stone blocks the flow of urine, of course. Difficulty starting or stopping urine flow. Imagine it being trapped in the valve that controls urine output. Imagine what will happen there. Then painful ejaculation. Of course, we know how that can happen. Frequent urinary tract infections are not left out because remember I just mentioned how urinary tract infections can cause it and how it as well can cause urinary tract infections because of the injury and unnecessary exposure of these inner parts of the urinary tract to bacteria. In fact, some of the bacteria even cause the kidney stones, and that is why it's important. We'll run certain tests that I'm going to talk about soon. Anemia is not left out. Remember that the kidney produces erythropoietin, which also sends signals to the bone marrow to produce more blood. So when the erythropoietin is not coming forth as it ought to, as a result of kidney damage due to kidney stones, we all know what will happen. There will be a drop in blood volume as well as concentration. Then we have fatigue and sweating as well. You can imagine this kind of pain. Wow, this man will definitely be sweating. Loss of appetite, who can eat gallantly when one is having this kind of pain? I doubt if anybody can do that. Abdominal tenderness, and of course, decreased urine output, probably as a result of blockage. So these are just basically the signs and symptoms. We should take very close note of this because sometimes people don't know what happened and they just feel that probably they feel some kind of pain in that area and they feel they're having one issue or the other without knowing that it's just kidney stones that are making their way to their destination. Now, what are the causes and risk factors? Now, kidney stones form where there's an imbalance of water, salt, and other substances in the urine, as aforementioned. But let's take very, very close cognizance of this cause, dehydration. Insufficient water intake concentrates the urine, increasing the risk of what? Supersaturation, as aforementioned. And that means that the solid material that was dissolved in the urine will begin to come out in form of maybe crystals and other solid matter. Now, hot climates and diarrhea can actually reduce the amount of fluid in the system and can provoke the formation of what? Kidney stones. So now, previous kidney stone history means that one can have it again because it has happened before. The same process may still be in place to make it happen again. Diet. Remember that in the case of uric acid excess in the blood or hyperuricemia that leads to gouty arthritis, one of the things that cause this uric acid excess is what? Animal protein or things that contain high purine in them. Then, of course, sodium also has its own role to play, because when there's excess sodium, it may lead to some issues that have to do with calcium. Now, sodium is on a higher level, is more reactive than calcium, and hence the calcium will be left behind to begin to form kidney stone in form of salts, as in the oxalates and phosphates, as aforementioned. High blood sugar as well is not left out. Even just a simple experiment, add a lot of sugar inside water and see what will happen when you stop stirring. It begins to come out, and that's how kidney stones form. So these sugar molecules that can begin to precipitate, in cases of high blood sugar like type 2 diabetes, can form a nucleus where other materials can begin to surround and gather and grow into larger kidney stones. Genetics is not left out because having a family history of kidney stones increases the risk. Bad gut microbes. Very, very, very important, because there's a strong link between our intestine or our gut and our kidneys. Remember that there's something called leaky gut. That means if the lining of the intestine is inflamed, unwanted materials or materials that should not have leaked into the blood, they begin to leak into the blood. And that is what is called leaky gut. And if these materials get over-concentrated in the kidneys, they can precipitate out again as what? Kidney stones. So inflammation in the gut can lead to unwanted materials leaking into the blood and later forming kidney stones when there are high concentrations in the kidney. Very simple. So examples of bad bacteria that can cause this, what we call Proteus mirabilis, Klebsiella pneumonia, and Pseudomonas aeruginosa. These are just a few examples that can cause inflammation and what? Malabsorption. Let us also bear in mind that these bacteria sometimes also increase the pH and may lead to all sorts of issues like that. It change the pH of the urine, and that can trigger what? Formation of nucleus, growth of kidney stones in kidneys. Other medical conditions like arthritis, gouty arthritis, diabetes, as aforementioned, and inflammatory bowel disease, remember we talked about leaky gut, can also be risk factors. Lifestyle factors like sedentary lifestyle, obesity, and what? Alcoholism. Alcoholism leads to what? Dehydration. Because alcohol is a natural diuretic, it will lead to excessive expulsion of fluid, thereby concentrating solutes in the urine, and can lead to formation of kidney stones because it dehydrates the body when it leads to excessive expulsion of fluid. You notice when people are drinking, they are always visiting somewhere called White House. Now, infection is not left out. Remember, we said that even the bacteria, apart from the fact that they can change the pH of the urine, they can change the pH of the urine, they can also themselves form nucleus where this problem can begin to accumulate all over. You can imagine a bacteria causing a sore around that area and making that area a bit rough. You see that something can begin to grow on top of that rough part because these supersaturated solutions will need somewhere to deposit their materials on. And that is why this can lead to problems. I've just mentioned a few. Oh, there they are again. You can see Klebsiella species there. Proteus species not left out, and Pseudomonas species as well, just as we mentioned earlier for the gut. Diagnosis simply entails one, physical examination, where the doctor will palpate the abdomen and kidneys to check for tenderness or pain. Naturally, if the stone is passing by, it should be sending some signal somewhere that is actually unpleasant. Then the medical history is also important. Of course, we need to know about the symptoms and lifestyle habits. If it's someone that doesn't drink water, or someone that likes taking excessive alcohol without taking water, or likes eating protein all the time without drinking water, you know that it may be possible. Urine test is not left out because urinalysis can detect blood, protein, or bacteria in the urine. Remember that we talked about blood, which is possible when the stones actually injure or cause a wound within that area where they are. Then the bacteria, as I aforementioned, may be the one that is causing problem or helping to grow the stone in the kidney and will also show in the urine. Kidney function test not left out. It helps to assess the kidney's ability to filter waste and excess fluids. It will even tell us how badly the kidney has been damaged, and it can also tell us the progress of treatment as well as other parameters. Now, imaging techniques may be demanded by the doctor or your health practitioner, depending on the situation on ground, and they include X-rays, CT scans, ultrasound, which is quite common because you know that these stones are hard, and when the sound waves from the ultrasound probe hits them, it bounces back and shows clearly where they are. Then we have intravenous pyelogram. This one has to do with the dye that gives us an idea of how the blood vessels are distributed in that area. Of course, MRI is not left out for more detailed assessment. Look, you see, stone analysis is also important because when you analyze the stone, you can have an idea of the origin of the problem as well, because uric acid stones are different in shape from calcium salt stones, which are also different from cysteine and also different from others. And you can see that can give us an idea. Blood tests are not left out because we want to know whether we're having underlying conditions like kidney diseases, gout, and so on and so forth, infection, as aforementioned. Now, this 24 hours urine collection will tell us how far or how well the urine is coming out from the kidneys. Biopsies may also be required, and so on and so forth. We've been hearing about kidney function tests all this while, but we wonder, what is this? You see, this assesses the kidney's ability to filter waste, regulate electrolytes, and maintain fluid balance, which helps to identify the presence of kidney disease. Remember that the kidney stones can cause kidney disease. That's why this is important. And it also helps to monitor the progress of treatment and monitor the progress of the disease. The types of kidney function tests may include blood tests. Of course, this will tell us a lot about blood, urine, nitrogen, and all that. Urine tests as well are not left out. Serum creatinine is not left out. Then, of course, glomerular filtration rate. This is so important. Remember, there's something called dialysis, and this also gives us a clear idea when to opt for dialysis, because a glomerular filtration rate that is less than 15 or thereabout, equal to less than 15, means that dialysis is imminent or impending or very important at that point in time. Then we have different stages of chronic kidney disease, and these are noted with regards to how well the kidney is functioning. You can see stage 1, which is normal, then 2, 3, 4, and stage 5. And that is why kidney function test is super, super important. Urinalysis, this cup on my screen will definitely be familiar to anybody that has gone for this kind of test before, because one has to go and void into something like this in a very sterile condition or atmosphere. So this urinalysis is a laboratory test that analyzes the physical, chemical, and microscopic properties of. Now, it helps to check for potential kidney or urinary tract issues, and if present, may require further testing and evaluation. So, now, for physical examination, we need the color. How clear is it? Because remember that if it is turbid, that means it may contain a lot of solutes that may be dissolved in the urine that may lead to kidney stone formation in the kidneys. Of course, specific gravity tells us a lot, pH and the odor, because if there's a strong infection, there are some bacteria that exhibit very, very terrible smell or odor. Example is E. coli. It has a very foul smell. I think it smells like rotten egg or something. And then we have chemical examination. We need to check whether we're having proteins there. Ketones. If we have ketones, remember that someone may be diabetic. maybe having a lot of ketones in there. Blood, of course, should not be there. Then we have white blood cells material should not be there. Glucose should not be there. Bilirubin should not be there. That shows that the liver is not being affected, because you know that there is what we call the hepatorenal system. That means whatever the liver is not managing, the kidney has to deal with it. And whatever the kidney is not managing, the liver may have to deal with it. And that's why it's a very, very unique relationship they've got there. And coincidentally or funnily, they are the two organs in the body that have the power to rejuvenate. That means if you cut the liver up into 3 and through 2 parts away, it can grow into a fresh liver. And if you cut the kidney into 3 parts and through 1 away, it can grow into a fresh kidney. That's just something very unique on the side. Then the microscopic examination tells us whether we have red blood cells in there, white blood cells and their quantity. Of course, we have epithelial cells, which should be rare. Bacteria should not be there at all. Yeast shouldn't be there. Parasites shouldn't be there. And casts. This may indicate that there is impending or already there's already a kidney damage that has taken place. If you look closely, you see that this man is holding what we call a microscope. He's trying to look at the material in front of him. And here's the material as it has landed over there. You can see that this urine microscopy culture and sensitivity is a diagnostic test that helps to evaluate urine for microbial presence. It helps to identify pathogens and determine antibiotic susceptibility. This is super, super important, because if we have bacteria there, we need to know the antibiotics that will be taken to wipe off this bacteria. So microscopy simply gives a visual examination of urine, sediments for bacteria, yeast, parasites, and so on and so forth. Culture will grow the microorganism in a controlled environment, and sensitivity will expose these microorganisms to different antimicrobial agents to be able to tell us which one of them will be able to eliminate this bacteria thoroughly. In fact, I have a case on ground right now that is related to something like this. If you look at this very large kidney stone here, you can see that this kidney stone is just saying something like, we no go agree for anybody. This kidney stone is very stubborn, and you can see in the picture at the bottom right corner of the screen, and the complications it's causing are what we're talking about right now. So complications of kidney stones can occur when the stone causes damage to the kidney or urinary tract, or when the stone blocks the flow of urine, leading to infections, kidney damage, and other issues. And these include what? Obstruction. When a stone blocks the flow of urine, it can cause what is called hydronephrosis, because the kidney swells due to accumulation of urine, leading to pain and potential kidney damage. Then it can also lead to infection, because the bacteria can multiply in what? Stagnant urine that is not moving. So they are free to just multiply and begin to form other colonies in there, leading to infections like pyelonephritis or sepsis. Also, the bacteria can colonize the stone on the urinary tract, causing pyelonephritis. That's infection of the kidney tissue, which can lead to abscesses or sepsis. Sepsis is not a good thing at all, trust me. Then we have urosepsis. That's when the infection has spread into the bloodstream, potentially causing organ failure. Then we have recurrent UTIs. So people are wondering why they're having urinary tract infection from time to time without knowing what's going on. These stones can harbor bacteria, leading to repeated urinary tract infection. They can just be like free accommodation for these bacteria, and the bacteria does not have to pay rent. Now you can see that kidney damage is not left out, because repeated or prolonged obstruction can lead to chronic kidney disease, permanent damage to the kidney tissue, potentially leading to what? Kidney failure. Then we have kidney atrophy. That's when the kidney has shrunk. You see that when you check some people's medical examination or a medical imagery test or examination, you see that one kidney is smaller than the other. These are the kind of things that lead to that. Then we have kidney tissue damage, kidney failure. Scarring is also very important, because you just imagine that someone uses a knife to slash a part of another person's skin. Even though it heals, you may be surprised that something may form there. Just as we discussed when we're talking about liver cirrhosis, when we're talking about on liver health upper week, you can see we talked about scarring, which is not good. That means it has altered the form or the way a passage or a structure in the body is meant to be, because that's formed a scar tissue. Even in cases where we have pelvic inflammatory disease, you see that scar tissue formation is what even leads to what is called ectopic pregnancy, because the egg cannot roll over the scar. It's not supposed to be there in fallopian tube, because the pelvic inflammatory disease can lead to inflammation in the salpinges, what we call the fallopian tube, and this can leave back scarring, which can prevent the fertilized egg from rolling into the womb, so that it can allow the baby to grow, and then the baby begins to grow outside the uterus, inside the fallopian tube, and indeed that is a medical emergency, because the fallopian tube can rupture and lead to bleeding and a lot of other things like that. So that is one of the, so it's a similar process. The scar tissue can prevent the normal function of the kidneys and other parts of the urinary tract. Now, the kidney abscesses that form as a result of pus-filled pockets in the kidney tissue. Then the nephrocalcinosis means that calcium deposits are also possible in kidney tissue. Then we have renal colic. That is the horrible pain I was talking about. It seems as if somebody just opened on that person's back and poured molten magma inside. It is a terrible feeling. So I heard, and I prayed never to experience. Then then we have urethral stricture, where the passage of urine has been constricted. And of course, we have the sickness that has no cure, or the ultimate sickness, which is death. Now, before I move further, this is just in the interest of science. I was supposed to give a warning, but this is very important, because sometimes we don't know what these things are like. So I just brought out this example to show us, so we can see what they actually can look like inside the kidney. This is somebody's kidney that has been removed, and you can see that you open, and just imagine this inside somebody's kidney. How can this kidney function when we have all these kidney stones lying in there? And this is what it looks like. This is very important, so that people can have a visual idea of what it can be and rush to the nearest place they can get something to drink, and also mind certain things we're going to talk about shortly, and also consider getting and using certain things we're going to talk about shortly. This is just what it is. Africans or humans often are not afraid of what they cannot visualize. But now that you have seen what can happen, believe you me, you will appreciate something we'll talk about very shortly. So how do we prevent this from happening? How do we prevent that horrible image from happening? The first thing we can do is to drink plenty of water. Staying hydrated helps to dilute the concentration of minerals in urine, reducing the risk of stone formation. Fela Nicola Kuti said it that water no get enemy. Water has no enemy. So we have to also bear this in mind. That water is our friend, but when we use it wisely. Of course, we know that water can change to something else if it appears in that way. But all things being equal, water no get enemy. It's supposed to be our friend. And we have to drink a lot of it to prevent kidney stones from forming. So God has given us this very cheap remedy. But the problem is that some of us are too busy. Some of us are too in a hurry to consider grabbing a bottle of water. Right, they'll grab a bottle of beer and follow them and just hold it tight before they're entering into the car, so they can continue to drink and dehydrate themselves even more. These are the things that are risk factors for what we just observed previously. Now, we have to maintain a healthy diet, because if you eat a healthy, balanced diet that is not too high in animal protein, sodium, sugar, etc., you see that we will not have or give our urine the opportunity to be super saturated. Of course, and our gut will also be healthy, so that it will not allow unnecessary or unwanted materials to leak through. We have to limit oxalate-rich foods, of course, reduce sodium intake, apart from the fact that it is detrimental to the cardiovascular system with regards to hypertension. This is another reason. We have to increase citric acid intake. We also have to get adequate calcium. Remember that calcium is not the problem, or it's not our enemy. It's just that when we take these things and we don't take water, that is where there's problem. And of course, we have different types of calcium. You have to also be sure to ask your health practitioner for the. I think the best we have so far is dicalcium malate. Yes, I think so. I think that's the best we have so far, because it's a noble molecule, and it stays longer in the blood without causing all these problems. Yes. Then we have to manage underlying medical conditions. Remember that diabetes is a first-class ticket towards high blood sugar. And you know what sugar can do in the urine when it is in excess. It can also form issue. Then gouty arthritis too is not left out because of the high level of uric acid in the blood, which can form uric acid crystals, and so on and so forth. Let us limit alcohol and caffeine intake because we know that this can lead to what? Dehydration. There are also other natural remedies which are often very popular among our chefs and others. As you can see over the apple cider vinegar and pomegranate juice, green tea, and all. Then we have natural pharmaceuticals which help prevent kidney stone formation. And guess what? They have no side effects. So we'll talk about that shortly as well. Beautiful. Now we're talking about management and treatment. You see, we're still talking about hydration, water, number one. So you can see that dietary changes include hydration. Drinking enough water helps flush out minerals and prevent concentration of urine, reducing stone formation. Even the stones that are there will begin to dissolve back into the urine. Let's take this very simple example. Imagine you poured a lot of sugar, as we have mentioned, in the water, and you see that the crystals are beginning to come out because of the excess amount of sugar that was in the water. They are coming out of the solution again. If you add more water, what will happen? They will disappear again. And that's exactly what happens when we are properly hydrated. Then we have sodium reduction, animal protein reduction, citrus fruits and juices, oxalate reduction, calcium management. These are also very, very important. Lifestyle modifications are also amazing because we need regular exercise to improve circulation and other good things it does for the body. Stress management is not left out because we do not want to have excessive secretion of what is called cortisol. Cortisol is a stress hormone, and it is a steroid that is produced in kidneys and maybe some other parts of the body, but we do not need that because it can lead to what? Inflammatory reactions that we do not want. Of course, because it looks like aldosterone, it leads to a chain reaction that may eventually lead to what? Kidney stone formation. We'll talk about that maybe some other time. Then sleep regulation is important. Weight management is also important, so we do not stress our system with our weight. Medical intervention includes thiazide diuretics, allopurinol, citrate supplements, pain management, of course, extracorporeal shockwave lithotripsy, which is non-invasive and can help to break these stones into smaller particles, and so on and so forth. But let's not leave out what? Dialysis and kidney transplantation. And of course, down here, we see natural pharmaceuticals, which help in prevention and management of kidney stone diseases without side effects. I keep talking about this medication here. Please, from time to time, but I always give this warning: do not adjust or take medication without a trained health practitioner guiding you or instructing you or giving that necessary prescription. That will make sure that there are no complications. Because these things we are looking at here, these chemicals we are looking at here, have side effects, and sometimes they are not as amazing as we think. Now, dialysis is very, 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 very crucial when one is already having a kidney that is going down, especially when the glomerular filtration rate is around or below 15, which is not amazing. So you can see that dialysis is a medical treatment that filters waste products and excess fluids from the blood when the kidneys are no longer able to perform these functions. Now, the types of dialysis includes hemodialysis, which is more popular. As you can see, that young man over there in the picture is relaxing and having hemodialysis. But let's bear in mind that behind the scenes, you see, many people that are restricted or cannot do without diabetes usually have a lifespan of about 5 to 10 years or more or less. Let me put it that way. So please, let's not allow ourselves to come into this situation at all. These are not good situations. I'm telling you, I had a patient that I was with, and he was on dialysis, and miraculously, the 2 kidneys began to function from nowhere. Till today, the guy has not had that problem again. In fact, I will say to that, what God cannot do does not exist. But please, let's not put ourselves in that situation. Of course, we have peritoneal dialysis and continuous ambulatory peritoneal dialysis. We have automated peritoneal dialysis and all that. But as aforementioned, the indications for dialysis include end-stage renal disease, acute kidney injury, chronic kidney disease, and electrolyte imbalance. Of course, fluid overload and all that. So what are the challenges in management of kidney stone disease? The first thing is when people are having poor access to water. In those days, you want to buy water, we don't even add, you don't add water into your budget when you want, but these days you must have to add water because we all know what's going on in this part of the world right now. Water that was next to nothing is now is now something. So you can see that some people don't have access to this water that we are swimming in and playing in, and that is another problem. Then late detection is another issue because it will go, don't worry. No, it's just a pain. I know it comes and goes. Brother and sister in the Lord, that may be a kidney stone that may be generating momentum to cause problem. Then we have self-medication, this is aka Sabinus. Some people like to treat themselves. They have kidney stones and they go and take what we call herbal concussions that are unstandardized. We call agbo or something. And then that will further dehydrate the urine and at the same time again cause more problems in the kidney. And of course, we do not want this at all. Now, poor patient compliance. When you tell the patient you have to start drinking water at least so and so amount per day. As you're telling the patient you have to start drinking water, the patient is hearing you have to drink more beer, you need to sleep in the club. That's what the patient is hearing, and that can lead to further dehydration and problem. That's a problem. It's a challenge in management. Poor health infrastructure. Basically, that explains itself. We don't even have where to go and solve your problem. No insurance, lack of trained health practitioners. Can see that this part of the world, there's a country I know that I keep saying is maybe one of the highest exporters of health practitioners on earth today. And I hope that God helps that country. Then we have economic challenges as well. You can see that when these complications arise and we need to perform certain unique procedures or take certain unique medication that may be very expensive, you see that could be cumbersome when we have general economic challenges. Poor health information and awareness system. Resistance to change because old habits die hard. Some people will say that rather than they leave alcohol, they rather die. And of course, sometimes that's the case because alcohol eventually lives after them. And you can see that there's fake medication as well. Depression is another problem because the patient is wondering what on earth is this horrible pain that can cause depression and suicidal tendencies. Poverty and high treatment costs, as aforementioned, is a terrible thing going on in some parts of the world today. Then we have chemical drug side effects. We'll talk about that shortly. And then predisposing staple foods, because there's some places you go to and what you just have is a lot of meat, a lot of purine containing proteins and all that, which can actually lead up to this problem. And a lot of other challenges with this. Now, this chemical intervention is very important because we are familiar with these chemicals because oftentimes when people have these problems, they have no choice than to run to the hospital and we prescribe through the procedure that you start next in some cases. Of course, this can be avoided. Now, generally, these medications work by reducing mineral concentration in urine, what water would have done for us or for the patient if the patient listened earlier. Of course, they can also increase urine production. Water could have done that as well. They also help to relax the muscles in the urinary tract, bind to minerals, making them more soluble. Water could have helped as well. Then, of course, reduce inflammation and oxidative stress. You see why water is so important. But now, when the patient has not listened and has gone beyond the point of no return, or it has almost gotten to the point of no return, you see the patient may have to use thiazide diuretics. For example, is the hydrochlorothiazide, clothalidone, metolazone, and so on and so forth. This is how they work. They reduce calcium excretion in urine and so on and so forth. We have allopurinol, of course, is not left out. Niacin is not left out. Alpha blockers like the tamsulosin. This will just help that area to relax, that the stone that was stuck can just pass. And that does not mean that there will be no pain when it's passing through. Then we have calcium channel blockers. Of course, they relax the ureter, the bladder muscles as well as aforementioned. Then we have the citrates. We know what they do. They help to prevent calcium oxalate stone formation and also assist in dissolving them as well. Then we have the phosphate binders, so on and so forth. Let's just talk briefly about their side effects. As some of us chew these things like chin-chin, we should also bear in mind that these things are not hobnobs. They also come with some side effects, apart from them costing a lot in some cases. These NSAIDs, we know that they can lead to ulcers. You can see the opioids are addictive because some people love cocodamol and they don't know why. Imagine somebody that never used to take addictive substances before and is being given cocodamol, and the person is wondering why, if he doesn't have cocodamol, or you just tell the person, oh, madam, you're already feeling better, you may not need cocodamol, and the woman turns to a vampire, and never, I must take cocodamol. It's addiction. Then we have medical expulsive therapy. we have urinary alkalization. All these things show their side effects. Even the tamsulosin is not even left out, dizziness, lightheadedness, and so on and so forth. You can see them there. This is not to discourage us, but to help us understand that these side effects are imminent when we do not do the right thing. That's why I say prevention is better than what? Early detection, and so on and so forth. Antibiotics, and so on and so forth. Why I like natural pharmaceuticals is that the first reason I love them for is that they do not have side effects, and they help and support these other chemical drugs, and even detoxify these chemical drugs in many cases. Because these chemicals, remember that in the last, when we're talking about the liver during liver weekend, you can remember I mentioned that one way or the other, the liver knows. I don't know how God did it, but if you take something that is not natural, the liver will know. I don't know how. Most times, you can't even sneak something in without the liver knowing. I wonder how a chemical compound that somebody has never been exposed to, and the liver just knows that it is not supposed to be there and begins to work against it. And sometimes it may lead to detoxification, but unfortunately, sometimes it may lead to production of more toxins. And that's why these chemical drugs are not always I'm not saying that, of course, I am an expert in chemical drugs, but I must also tell the truth. Many of them have side effects that you don't need to wonder why we write those side effects in very tiny letters, because if they are too bold, nobody will buy those drugs. Now, on the other hand, natural pharmaceuticals help prevent kidney stone formation, dissolve kidney stones, hinder bacteria that may lead to kidney stone disease, boost immune system against bacterial infection, prevent or manage conditions that lead to kidney stone. For example, the gouty arthritis we're talking about and type 2 diabetes. Then, of course, they destroy free radicals and reactive oxidative species that damage kidney cells' DNA via antioxidants. Now, they help in weight management and detoxification. So remember what the kidney does. So you can see they're even supporting detoxification. Maintain a healthy gut, at least to avoid leaky gut, so that unwanted substances will not leak through the gut and go into the bloodstream and later go and cause problems in the kidneys by supersaturation, as aforementioned. They also help to regenerate and rejuvenate damaged kidneys and urinary tract via what? Somatic stem cell stimulation. I always tell people that those that say that they're putting stem cell under their tongue, they're putting stem cell in their mouth, all those things are wrong. We don't have that technology yet. The only pluripotent stem cells we have now are found in the bone marrow. That is when we are adults. But as we are growing in our mother's wombs, of course, in the initial phase of formation of the baby, after fertilization, of course, we have pluripotent stem cells that differentiate into our heart, lungs, our head, our hand, other parts of our body, and organs and all that. But once we are born and all that, it's mostly somatic stem cells that are left. You can only stimulate these somatic stem cells to act faster, and that is why these natural pharmaceuticals are important, because they can stimulate somatic stem cells to repair damage. That is what they do. So if you're hearing about people taking stem cells that will go into the stomach, and the acid in the stomach will destroy it instantly. Going under the tongue, of course, is a no-no, because how would the cells pass through the barrier of the sublingual area or under the tongue when they are also made of cells? So please, let's take note of that and don't waste our time when we're doing things. Then we have that they prevent and resolve inflammation in the kidneys. Of course, you know that anywhere there's injury, inflammation often follows suit. And they help to heal scarring caused by kidney stones. Remember, we talked about scarring. They can help us to dissolve that. So now, what I want to show us now does not necessarily mean that we must have to get what I'm showing us now. These things are just like, how do I put it? I will say this is what I used to treat my patients. But I think you can just focus on the active ingredients. If you can get these active ingredients anywhere else, good luck to you. But what I use for my patients and it works for them is what I'm showing us right now. These are examples I use for my own patients. It's not compulsory that you must get this, but if you are my patient, this is what I will most likely give to you, because I've used them and they have worked fantastically well. In fact, I have a patient that had fatty liver disease and kidney stones. And to God be the glory, within a month, I think he posted a testimony on that somewhere on social media, but I don't think, as a practitioners, we don't even have time to be checking all those testimonies. Maybe one of these days I'll go and get it, and maybe I'll see if I can get it somewhere. That guy was so scared, but you can see he used these things and he's okay now. A young boy, and he's fine. Though he never came back. The liver went back to somewhere below 14. 14 centimeters, and then the kidney stones were nowhere to be found. No surgery was done. That's just how powerful these things can be. So, be that as it may, we have bee propolis. Now, it's a powerful natural antibiotic with antimicrobial, that means antibacterial, antifungal, and antiviral effect. Remember, we talked about some terrible bacteria like the Proteus species, that's the Proteus mirabilis. We talked about Pseudomonas aeruginosa, talked about one or two others like that, that could actually lead to problems by changing the pH of the urine and also form nuclei where the kidney stones can form. You see that this will help to what? Assist in eliminating them. Now, they have anti-inflammatory properties, antibacterial properties, they are antioxidants as well to protect the kidney cell DNA from what? Damage caused by free radicals that often surround those affected areas. If you remember when we were talking about cerebrovascular accidents, remember we talked about ischemic stroke being riddled, or so the part that ischemic stroke has affected has an umbra and penumbra that is full of reactive species that have damaged the cells, that are damaging more cells. From those cells that are dead or dying, accumulation of these free radicals worsens the situation. And that's why you see that I use very powerful antioxidants when I'm working with patients that have ischemic stroke. So you can watch that on YouTube on Dr. Drugs if you want to know more. Then we have aloe vera gel. Anytime I come to this product, I get tired sometimes because what it can do is uncountable. These products, let's just make it brief in short, because we can talk about this from today till tomorrow. Now, aloe vera gel, also known as the wonder plant, with an inexhaustible list of benefits. In fact, the benefits are numerous. Now, they prevent kidney stone formation, and they have anti-inflammatory properties. We'll talk about that. They have analgesic properties because they contain what is called anthraquinones. Can you imagine? Now, they have antioxidant properties. Remember, we talked about free radicals and DNA damage in kidney cells that can be prevented with these antioxidants. We talk about immune support because they contain asemana. Remember that when you have good white blood cells or good immune support, the bacteria will not have anywhere to anchor. Anywhere they touch, the white blood cells will just engulf them. And that is what it is. Then somatic stem cells. This is a real somatic stem cell stimulant. And that is why, if you notice, even from time immemorial, when people have burns, they talk about applying aloe or other adaptogenic substances like maybe honey and all that. You see, aloe vera is applied on a burn. If someone has someone had a burn and it's applied as early as possible, you see that it will not be as bad as it would have been if there was no aloe vera gel applied on it. And you can see that this is very powerful. It has been used for up to 3,000 years or more. So it's not even today, from the time of the pharaohs. Then it has antibacterial properties as well, which is also amazing. Then it hinders bacterial attachment to the urinary tract. Now, this particular one with the red cap here that is in a white bottle contains what are called cranberry extracts. They prevent bacteria from what? Attaching in the first place. And that's why this is very important. You can go and Google cranberry extract and how they do that. That's why you see a lot of women love this product. But it's not for only women, also for men as well. Immune blend, from the name immune blend, you should have something, a bell ringing. That is basically to boost immunity, and also has antioxidant properties, has immune system support. Not only does it boost immunity, it also sensitizes the white blood cells that are already available for action. Just imagine some soldiers standing idly and they don't have any rifle. Then immune blend comes and shares rifles to these soldiers and say, that's your enemy over there. And that's what it does with the white blood cell. So it's very, very important. Then it also has anti-inflammatory properties. We talked about that earlier. Garlic thyme is not left out because it contains very powerful antimicrobial and antioxidant ingredients. And that's why you see it's very, very unique. Of course, we know that garlic extract and thyme extract have been used for ages. Now, these antimicrobial properties help to inhibit bacterial infection. Then, of course, there's immune system support, antioxidant properties, and anti-inflammatory properties. But let's not forget that it also has lecithin. And this lecithin emulsifies fat. That means if it's a case of renal artery stenosis, for instance, you see that the lecithin can help to clear the renal artery and improve blood flow to that area. Renal artery stenosis just means renal artery blockage. Now, Arctic Sea contains omega-3 fatty acids. This product is amazing. Apart from the fact that it has very powerful anti-inflammatory properties, it's also very good for what? The brain, because it contains eicosapentaenoic acid and docosahexaenoic acid. These are essential fatty acids that our bodies cannot produce on their own. In fact, in children that have intellectual disabilities like autism and dyslexia, when you give them this product for a while, you see that the child will begin to improve intellectually because the brain actually loves this product so much because it helps to produce a lot of materials that help in brain function. So you can see that they hinder kidney stone formation, they have anti-inflammatory effects, antioxidant properties, immune system support, they have anti-hypercholesterolemic action. So you can see that renal artery stenosis is not left out from the matter. Then we have other health conditions that they help us, that because they have anti-cholesterol aggregate ability, that also helps to reduce peripheral resistance and also very useful in treatment of hypertension. I hope you know that hypertension is not always untreatable, and in fact, hypertension is treatable. In fact, if you go and watch the video I made on hypertension treatment, Dr. Drugs on YouTube, you will see where I even screenshot a section that is on the internet there with you, showing that hypertension is treatable. Not, I didn't say it, you say that. Of course, I discussed how that is achievable. This is another wonderful product because it contains coenzyme Q10 and a lot of other things that are useful for the heart, the lungs, the liver, and kidneys. Even when you're talking about treatment of hypertension, you cannot do without this. Oftentimes, some people have dilated cardiomyopathy. I add this product there because of its ability to regenerate and rejuvenate the heart, the lungs, the liver, and kidneys. So that's why I always add it. That's why it's one of my secrets. I've been having successes. In fact, I have a patient on this now. And in a very short time, by the end of this month, we're going to have the ECG again and see how far it has gone, because I have had 100% success when I also add this product there. Then, of course, antioxidant properties it possesses. Let us bear in mind that these products are to assist or to help whatever we are doing, and they are not here for us to ignore or forget about our doctor's prescriptions. That these products are to assist and make sure that these prescriptions and health treatments go as well as possible. Then, of course, energy production, because it helps the kidneys function properly by supporting up and optimizing cell mitochondrial activity. The mitochondria is like the powerhouse of the cell. The regeneration and rejuvenation is not left out because it helps the kidney cells heal and recover. I mentioned that earlier. And the immune system support is not left out. But let us also bear in mind that it has anti-cholesterolemic properties because of the coenzyme Q10. Coenzyme Q10 is known to reduce high blood cholesterol and hence also reduce peripheral resistance, which is responsible in about 95% of cases of hypertension. So you can see that it's also needed in or indicated in the treatment of hypertension. The reason why this product seems as if it has a lot of things written all around here is because of its effect in the gut. Let us bear in mind that Bifidobacterium and Lactobacillus species are very, very good bacteria that we find in things like Greek yogurt and all that. But guess what? We have about 6 different strains in this particular product, making it very, very potent. Now, what this does is that it supplies good bacteria into the gut, and these good bacteria suffocate and suppress the bad bacteria like Klebsiella, the Pseudomonas aeruginosa. Now, this gives us about 8 billion colony-forming units. And bear in mind that good bacteria is very important in the gastrointestinal tract for functions like boosting the immune system, because you know that we have the gut and immune system axis. Then, of course, we have the gut-brain axis as well. Let's not forget that. That's why you see that sometimes people have typhoid and other enteric bacteria issues that cause enteritis and all that. Is that the person sometimes begin to hallucinate because the brain is now showing flashes of things that are not there, because there's a very strong link between the brain and where the gut. That's just on the side of the topic for another day. Now, they also help to produce vitamin K2, which prevents bleeding. Or let me say vitamin K. Let's call it vitamin K. Vitamin K2 has a unique function actually, because apart from that, it prevents bleeding, or is an analog of what prevents bleeding. It also helps to translocate calcium from the flesh, arteries, and other places where it can lead to cholesterol aggregates forming and blocking the blood vessels, and also cause problems everywhere, back to where the bones. We have osteoblasts. Osteoblasts love this because it gives them the morale to begin to build the bone. So we mothers that, or women that are having menopause, which leads to osteoporosis as a result of drop in estrogen, should appreciate this product because it leads to what increased production of vitamin K2 that will help to counter that osteoporosis and help the calcium deposited in places that are not supposed to be to begin to get translocated back to the bones. That's just on the side as well. Now, they also competitively outnumber and mitigate the effect of bad bacteria by secreting acetic, propionic, and lactic acid. These are also very important. As a bonus, they also hinder bad bacterial inflammation in the gastrointestinal tract. And guess what? We talked about this is just typhoid fever on the side, it causes inflammation of that area. But remember, we talked about leaky gut. So by maintaining the integrity of the gastrointestinal tract, you see that unwanted materials that may go and form kidney stones will not be allowed to leak into the blood from the gastrointestinal system. You can see that. So more specifically, this active Pro-B or probiotic is a very powerful probiotic which contains Lactobacillus acidophilus and Bifidobacterium lactis that help against gut health issues that lead to kidney stone disease in coming weeks. Now, maintains a healthy gut microbiome. It supports the growth of beneficial gut bacteria, promoting a healthy gut microbiome, as aforementioned. It inhibits inflammatory responses, supports mucosal integrity, that is the barrier between the food that is passing and your blood. So you can see that if that barrier is compromised, unwanted substances or whatever enter through the mouth that is passing through them may just find itself concentrated in the kidney and what? Kidney stone. So you can see that also reduces oxidative stress, which helps to protect DNA damage by what? Reactive oxidative species because of this quality. The reason why I want to talk about this product is because if we look at what we've been talking about all this while, you'll find out that it's not only when people do not take enough water that they begin to have tendency to have kidney stone. Let us bear in mind that not only lack of water that is the culprit, also when we take things that are not needed and they are now what? Forming toxins in the system and depositing where they're not supposed to be. I'm going to tell us something about autophagy shortly. Now, Clean 9 program is a 9 days detoxification and weight management program designed to reduce caloric intake and increase caloric expenditure, what systematically via use of low-calorie diet plan, exercise, autophagy, which is therapeutic fasting, let's just underline that, and then natural pharmaceuticals while ensuring adequate nourishment. You see something that talks about this in more detail. We'll talk about lifestyle modifications, weight management, and detox on YouTube in Dr. Drugs channel is there. Now, it systematically includes intermittent appropriate fasting that helps detoxify the liver and gives the kidneys what? A break to recover, because the kidney actively detoxifying substances that are floating around and causing problems, at least to even rest and have some time to what? Regenerate and rejuvenate. And of course, because it uses a lot of water in this program, you find out that it gives the opportunity for the kidney stones to begin to what? Dissolve. I've used it for a patient before, and the result was astonishingly remarkable. Now, it also helps generally against other lifestyle diseases via reduction of high blood cholesterol and materials that worsen kidney stone disease, like high blood uric acid level. It ensures weight loss professionally without affecting the kidneys. Then detoxifies the kidneys of kidney stones and help in healing the damaged kidney tissue because of the what? Because aloe vera gel and some other things that have been discussed in that video I mentioned. So I really appreciate us for being here. But before I let us go, I have some little things I would like to tell us. Remember that you are what you consume, and there is a constant battle between factors that repair and protect our bodies and those that break it down. So we just have to be what? On the winning side. And also, kindly remember not to adjust medication and dosage without the guidance of a trained health practitioner. This is very, 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 very important. Water, indeed, truly is life. A well-hydrated kidney is what? A happy kidney. As you can see that kidney over there, well-hydrated, and is saying hi to us. Hi, kidney. Then, finally, prevention is better than early detection. With this, I will say thank you for coming. I know it's kind of late, and I appreciate all of us. Remain blessed, and God bless. From me, Dr. Drugs, to you all. Bye.